Hi, I'm Richard Santucci. I'm a reconstructive urologist at the Crane Center for Transgender Surgery. I'm going to talk to you today about getting consent for liposuction from your insurance company. So here at the Crane Center, we actually spend quite a lot of time advocating for you with your insurance company. Even when gender confirmation surgery is a covered benefit, a lot of times there can be a lot of hoops to go through. One of the procedures that we have a lot of trouble with is liposuction, and I'll explain why later. And this generally requires us to have a voice-to-voice conversation with a peer at the insurance company. And this is quite time-consuming, as you can imagine. And the reasons for it are kind of interesting. The problem is that most insurance companies do not cover liposuction because they're thinking of body liposuction, the kind of treatment you would do to get rid of your love handles, and they simply aren't covering that. But they may not realize that we're talking about a completely different sort of liposuction on the phallus. Usually this is required in most or maybe even all ALT thigh donor phalloplasty patients. In that surgery, through no fault of your own or our own, the girth of the phallus can be too large to work either aesthetically or functionally as a phallus. And so the procedure is really not complete until the phallus can be contoured down into a safe and reasonable size, and that's done with liposuction. The difficulty is that there really aren't a lot of insurance codes for liposuction. There's just 15877, which means liposuction of the body, and that's almost always specifically rejected by insurance companies because there is no code for liposuction of the phallus after phalloplasty. So you can see that it gets rejected a lot, and we have to explain the not so subtle differences between those two procedures and ask the insurance company to reconsider their out-of-hand rejection of the procedure. This procedure is absolutely required for transgender patients undergoing ALT phalloplasty. Really, an ALT phalloplasty is a multi-stage operation, and it isn't correct to cover and allow the first stage procedure and then reject and not allow the subsequent stage procedures that give the final result. A too large phallus is very difficult for the patient. It can be difficult to lug around. It can be difficult to conceal under clothing. Once we place a penile prosthesis and allow intercourse, it can be difficult or impossible to use a too girthy penis for the purposes of intercourse. So it's really a mandatory, known second stage operation for all ALT phalloplasty patients. So what do we do in the procedure? So after gently going to sleep from anesthesia, two very small incisions are made in the end of the phallus, usually between the point where your urethra has been sewn to the phallus skin. Then some local numbing medicine is placed into the phallus, and a trocar, which is a long metal tube, is placed through those incisions, and a kind of cross-hatching pattern of liposuction is performed. The cross-hatching is important to keep the amount of fat removal even, and also because it creates a little bit of subsequent scarring of the skin, which also contracts down the skin of the phallus and makes it smaller. So the phallus gets smaller through two mechanisms, one by literally removing fat, and 2, by causing these trocar tracts that cause a little bit of contraction and scarring. Afterwards, the incision is sewn up and usually glued with some biological glue, so you're able to take showers immediately and it doesn't need any special wound care afterwards. The risks of this operation are pretty small. A lot of my patients ask me if it's possible that they could get loss of sensation, and that seems theoretically like it could be a risk, but it doesn't really seem to happen to our patients after this procedure. It's also important to know what the goals and limits of liposuction are. Basically, we can do either small, medium, or large liposuction. If we do a maximum amount of liposuction, the amount of reduction in penile girth would probably be no more than about 30%. If we do a medium amount, maybe we're looking like 20%, and if we do a little bit, maybe we're looking like 10% girth reduction. Realize that some people need a second liposuction, and if you end up getting a second liposuction, the fact that you have some scarring from the previous liposuction means it's always a little bit less effective, and maybe the maximum result with the second liposuction may only be about 20%. You can have other procedures at the same time as liposuction. Some people will get a so-called penile plication, where the skin of the underside of the penis is gathered together to make the whole girth of the penis a little bit less, or the base of the phallus may need to be reduced. I call that a base reduction, so those can be done at the very same time. The one procedure you really can't have together with liposuction is a penile prosthesis. There's no way to place a sterile penile prosthesis implant at the same time as doing liposuction, so those things need to be done far apart in time from each other. Realize that when you finish immediately, your phallus will be noticeably smaller, and if you're the measuring type, that's probably when you should measure it, the same day you have surgery, because the following day you're going to get a lot of swelling. The phallus really becomes hugely swollen for days or weeks, and rarely even months after that surgery, and so you won't really know its final result until all of that swelling has gone away. It's also really important to let all of that swelling go away before any future surgeries are planned. So for example, we also don't want to do glandsplasty at the same time as liposuction, because the liposuction is going to change the configuration of the phallus, and we don't want our glandsplasty that looks good when we do it to look funny or wonky afterwards because of the way that the phalloplasty liposuction healed. So you wouldn't want to have, say, glandsplasty in 3 months after liposuction if the swelling hasn't all completely gone away. So lesson there is it's important to let the swelling go away before any subsequent surgeries on the phallus are planned. While liposuction of the phallus is often rejected by insurance companies, the good news is that after a peer-to-peer discussion with the insurance company, it most often is covered, maybe 90 or 95% of the time. In the rare cases when it's not covered, it's usually because the insurance company has an absolute prohibition on any liposuction for any reason, and it can be very difficult to convince them to change their mind on that. If that happens to you, we will work with you on a cash pay price. The good news is it's a brief procedure and a small procedure, and a reasonable cash pay price can usually be worked out between the two of us.